Hello, Dr. Baker and class. My audience today is Daryl, Paul, Tony, and Mary. I'm here today to tell you about a form of cancer known as leukemia. So, what is leukemia? Leukemia is cancer of the body's blood-forming tissues, including the bone marrow and lymphatic system. Simply put, it's cancer that affects the blood and lymph nodes. There is not one type of leukemia. There are several different forms. Some are common in children, while others are more common in adults. Leukemia typically affects the white blood cells, which are the cells of the immune system that help fight off infections and diseases. In an individual with leukemia, the bone marrow produces abnormal white blood cells. The cells begin to multiply and function improperly. To determine which form of leukemia a person has depends on what type of blood cell becomes cancerous. Throughout this speech, I will discuss the different forms of leukemia, the treatment options available, and what places someone at risk of developing the cancer. I will also tell you a personal story about someone very close to me who is currently battling leukemia. As I mentioned, there are multiple forms of leukemia. There are actually 4 primary types. AML, which is acute myelogenous leukemia, CML, chronic myelogenous leukemia, ALL, acute lymphoblastic leukemia, and CLL, chronic lymphocytic leukemia. AML actually has several different names: acute myeloblastic leukemia, acute granulocytic leukemia, and acute non-lymphoblastic leukemia. It also has 8 different subtypes, which is what distinguishes it from other main forms. They are based upon the cell that the leukemia developed from. The subtypes are myeloblastic M0, myeloblastic M1, myeloblastic M2, promyelocytic M3, myelomonocytic M4, monocytic M5, erythroleukemia M6, and megakaryocytic M7. AML is the most common form of acute leukemia. It's very fast growing and occurs when the bone marrow begins to make blasts, which are cells that have not fully matured. CML is cancer that forms in the bone marrow and then spreads to the blood. It's a slow-growing cancer, but this can change quickly. It can progress into acute leukemia, which is worse and can spread to other organs. It is linked to an abnormal chromosome, which is known as the Philadelphia chromosome. This particular chromosome is an abnormality that occurs when a piece of chromosome 22 breaks off and attaches to the end of chromosome 9, which then breaks off and attaches to chromosome 22 as well. The break in the chromosomes combine to create the cancer gene. CML makes up for about 10 to 15% of all types of leukemia. ALL is a form of leukemia that occurs when abnormal white blood cells build up in the bone marrow. It's also a fast-growing cancer that is carried from the bloodstream to other organs. The organs that can be affected are the brain, liver, lymph nodes, and testes. It's known that ALL is associated with the presence of more B cells than T cells. B cells help to prevent germs from infecting the body, while T cells destroy the infected cells. CLL is a slow-growing cancer that begins in the bone marrow and spreads to the blood. There is also the risk of spreading to lymph nodes and other organs such as the liver and spleen. It occurs when too many abnormal lymphocytes grow, which overpower the normal lymphocytes. There are several different treatment options, which are all dependent upon the individual, the type of leukemia, and the progression of the cancer. AML can be treated with chemotherapy, radiation therapy, stem cell transplant, and target therapy. CML can be treated with chemotherapy, radiation therapy, stem cell transplant, and immunotherapy. ALL can be treated with chemotherapy or chemotherapy with stem cell transplant, radiation therapy, and immunotherapy. CLL can be treated with radiation therapy, chemotherapy, stem cell transplant, and immunotherapy. In case you don't know what the different treatments are or what they do, I will tell you a little bit about them. Chemotherapy is the treatment of disease by the use of chemicals. Radiation therapy is the treatment of disease using x-rays. A stem cell transplant is also known as a bone marrow transplant. It's a procedure that infuses healthy blood stem cells into your body to replace damaged bone marrow. Immunotherapy is the prevention or treatment of disease with substances that stimulate the immune response. All of the treatments discussed serve an important role in the treatment of leukemia. There are usually different risks for developing any cancer, but the risks for developing leukemia vary from form to form. For AML, people of any age can be affected, but typically it affects individuals as they get older. It's also more common in males. Certain risk factors that increase the chances of someone developing AML are smoking, certain chemical exposures, certain chemotherapy drugs, radiation exposure, certain blood disorders, and genetic syndromes. For CML, people of age 60 and older are most commonly affected. It too is more common in males. The only risk factor associated is radiation exposure. For ALL, people who are 15 and younger or 45 and older are at most risk. The risk factors are radiation exposure, certain chemical exposures, certain viral infections such as mono, genetic syndromes, race. It's also more common in males. And if you have an identical twin with ALL, you're more at risk. For CLL, the risk factors are certain chemical exposures and relatives with CLL. It's more common in North America and Europe than in Asia. It's also more common in males. So, I would like to tell you a story, the story of my sister. Erica was 19 years old when she was diagnosed with CML. I remember it like it was yesterday. She had just finished up her freshman year of college at Penn State. One night she approached my dad and asked if she could join a gym because she felt like she was gaining weight. My mom had overheard her and asked to see her stomach because the couple days before she noticed that it looked like her stomach was bulging. So my sister lifted her shirt and showed her, and my mom noticed that it was distended. So of course she was like, Erica, you're not gaining weight. Like, your stomach is distended. You need to get to a doctor. It actually looked like she was pregnant. That's how much it was bulging. And so my mom brought her to the pediatrician that Monday. The doctor took one look at my sister and asked if there was any chance if she was pregnant. She commented that my sister is at the age, she's in college, and so on. My sister laughed and said, no way. The doctor had never seen anything like it, and she still insisted my sister was pregnant, just by looking at her. She felt her belly, could feel it was enlarged, so she ordered blood work. The doctor calls my mom several days later and says, good news, Mom, everything came back normal. She suggested that my sister still see a gastrointestinal doctor to do an endoscopy just to be sure nothing else was going on. My mom scheduled the appointment right away because she knew something was not right. Erica got an appointment right away. The doctor felt her belly and looked at my mom and said, something is very enlarged, but I cannot tell what it is, so she ordered an ultrasound. I remember my mom saying the tech performing the ultrasound said, your doctor will be calling you in a couple of hours. My mom knew something was wrong because when you have an ultrasound done, an x-ray, it's usually, you should have the results in about a week, but if you don't hear back, give us a call, give the doctor a call. The doctor never called, so my mom figured, no call, no problem, everything must be fine. It wasn't until several days later, because it slipped through the cracks, that the doctor called my mom while we were at Shriners Hospital because my daughter had just had surgery on her thumb. We were in the recovery room when my mom got the call. I remember my mom's face going blank and saying, okay, doctor, we'll take care of it right away. She got off the phone and tried to hide the fear, but she couldn't. She started crying and told us what the doctor said. She told my mom that Erica's spleen was very enlarged. It was 3 times the size it should have been. She informed my mom that something was seriously wrong, but she can't say for sure until she orders more blood work. The pediatrician she saw the first time was so worried that my sister was pregnant that she didn't order the most important blood work that she could have ordered, which was a complete blood count. Erica went Saturday morning for the blood work. Sunday was a typical Sunday in our house. My parents went to church. I was home with Mackenzie because she had just had her surgery. And Erica was still sleeping because she had been very tired recently. The phone rang and I saw it was the pediatrician's office. I remember my heart sank. They're closed on Sunday, so something must have been wrong. I answered the phone and the doctor asked for my mom. I told him she's at church, but I will have her call as soon as she gets home. He tells me to make sure she does because it's very important. I started crying because I knew it was not good. I said, "Is everything okay with Erica?" But he could not tell me due to the fact that it would have been a HIPAA violation, but he made sure he stated again, make sure she calls me right away. I hung up the phone and called my mom, even though I knew she wouldn't have her phone on during Mass. I called over and over again until she finally called when church was over. I told her what the doctor said, and she told me she would be home in a few minutes and would call when she got home. My mom and dad pulled up, and I could see she was on the phone. I remember she took one look at my dad and announced that it was leukemia. Everyone went into panic mode. My dad had to wake my sister up, and I remember her coming to the bedroom door, and she saw all of us crying, and she just said, like, "No, no, no, I don't want to know," because she thought it was somebody else in the family. My dad had to tell her that she had cancer and they had to get to the hospital right away. Erica cried for about a second. She was better than the rest of us. My parents took her to the hospital. She had a bone marrow biopsy, which was the most excruciating pain she had ever felt. The biopsy is what told us what type of leukemia she had. The blood work showed how many white blood cells she had, and it was through the roof. She was only in the hospital for one night. She was so strong, and she never showed any fear. Erica is now 21, and she is still on chemotherapy. It's actually in a pill form, which she takes every day, 3 times a day, and there are many restrictions to this. She will be doing this for the rest of her life. If she were to stop taking the chemo, the leukemia would come right back. I am proud to say that my sister was told she was in remission several months ago. Although she's in remission, her fight is not over. Every day we worry that something will go wrong because she will always have leukemia and it could always get worse. But for now, Erica and my whole family keep our heads held high and love to say, Erica kicked cancer's butt. Leukemia is one of the most common cancers that people are faced with. There are several different forms that can affect both children and adults. If you were to hear the word leukemia years ago, you would instantly think it was a death sentence. However, there are many different treatments that are allowing people to live their lives longer, and some people can reach complete remission, depending on which form of leukemia you have. Oncologists are doctors who treat people who have cancer, and hematologists are doctors who specialize in blood disorders. The two work closely together to assure the patient is receiving the best care and treatment possible. Not only do doctors play an important role, but the people who are close to the one battling cancer. They offer a great deal of support. They are there through the good and the bad times. They are with them throughout their journey. If you know someone who is battling cancer, remember just how much you impact their life and how much they need you. Never give up. We want to be able to hear our loved ones say, "I stood strong, I fought hard, I won."